only 12% of US adults have the health literacy skills needed to manage the complex demands of our healthcare system. And this staggering statistic alone makes the case for advocacy. I'm Christina. Today we're talking about advocacy. It's an ethical imperative, it's a business necessity. We'll explore how proper advocacy can transform outcomes, reduce costs, and why your system needs to invest in it. This is a powerful case study from Cleveland that demonstrates advocacy's impact in concrete numbers. Starts with a healthcare organization with 110 employees, and they implemented a patient advocacy program to address challenges with benefit plan navigation and care coordination. And the results was over 74,000 in savings in just the third year through reduced duplicate testing, eliminated unnecessary procedures, and optimized medication use. They saved employees over 25,000 by correcting billing errors. So this isn't just about numbers, it's about changing healthcare delivery. And this is why your system needs robust advocacy and how to achieve those kinds of results. Let's talk about what we mean by advocacy. Healthcare advocacy goes far beyond basic support or care coordination. It's the active pursuit and defense of patient rights across the continuum. So this is across multiple systems. This is the difference between giving someone a map versus actively clearing the road ahead of them. And this is how advocacy differs from other support roles. So you may be familiar with care coordination. This is the organization of those services. You may be familiar with case management. This is monitoring and guiding care plans. Health coaching will educate and motivate the individual patient on sort of a one-to-one level. Then there's advocacy, and advocacy actively challenges barriers and fights for change. So there are types of advocacy. Healthcare advocacy operates on multiple levels, and understanding these distinctions is important. Each type serves a specific function in improving outcomes. So there's clinical advocacy. This is fighting for specific treatments. This is challenging insurance denials, pushing for specialist access, ensuring proper pain management. So this is obviously clearly suited to more clinical roles in the healthcare organization. And then there's social advocacy. So this is housing security intervention, food access programs, transportation solutions, community resource development. And this matters so much more than you think. We know that 80% of outcomes hinge on social determinants of health. So this is the proactive influence of those social systems and garnering enough social support in the community so that the patient will be successful beyond their discharge, so that all of the intervention that was received in-house sticks. Then there's legal advocacy, and this is benefits appeals, disability rights, housing discrimination, employment protection. Systemic advocacy. This is policy change, program development, system redesign, health equity advance. And I actually want to reverse for a minute and back up for a minute and talk about legal advocacy, because legal advocacy happens in the clinical team. And this is what I mean. This is kind of a big statement here, but legal advocacy happens with the clinical team. So much of how it is decided who deserves welfare is dependent on clinical judgments. So we know, and I've said this, I say this after 10 years of testifying about a individual's ability to function in their society. So this in society. So could be, because of their mental health. So when social work testifies towards somebody's need for sometimes an involuntary psychiatric treatment admission, when a social worker, as I've done many times, sits on the phone for an hour or sometimes over an hour, trying to apply or help apply a patient's application for long-term care benefits or Medicaid benefits in your state, whatever applies to you. And the other part of that is excuses for work, like work letters, FMLA, that kind of thing. Another part of that is also guardianship cases when we testify on behalf of the healthcare organization about somebody's mental capacity, and ability to make choices for themselves, and that kind of thing. So legal advocacy, it seems like something that's kind of siloed to your legal department, but really it's taking place in the clinical setting. Anyway, so we'll move on about the business case for advocacy, and we'll talk numbers. Okay, so it's given that 88% of adults struggle with health literacy in our complex system, advocacy isn't just support, it's essential infrastructure. Healthcare advocacy drives ROI through multiple channels. And the first is direct cost reduction. So we can break down those real numbers from our case study. This is 74,000 saved in a single year through elimination of unnecessary diagnostic procedures, reduction in duplicate testing, optimization of medication use, and over $25,000 recovered in medical billing error corrections. So there's measurable decrease in claim utilization by year 2. The program costs then are offset by utilization improvements. We're also talking about revenue enhancement here. So improved reimbursement through proper appeals, better documentation of social complexity, increased patient satisfaction, enhanced quality metrics. And this is a really big thing in the age of value-based care. Risk mitigation. Risk mitigation is also going to be a really huge thing in the transition to value-based care, but it's also going to be very important in the transition to home-based settings, remote monitoring, sort of digital care platforms, and that kind of thing. So this is reduced legal exposure, better regulatory compliance, improved patient safety outcomes, and enhanced reputation management. The broader case, beyond pure financials, advocacy delivers value through medical benefits, better treatment adherence, improved outcomes, reduced complications, better preventive care. There's ethical advantages. This is enhanced health equity, improved access to care, better patient autonomy, stronger therapeutic relationships, political benefits, so giving back to these communities that you serve. There's also a relationship with the community there that is influencing how the community is using the healthcare system. Enhanced brand reputation, stronger stakeholder relationships, and better regulatory relationships. Research shows that successful advocacy programs require systemic implementation. So if you are looking for guidance on implementation, you want to maximize the impact of your advocacy by investing in dedicated advocacy staff. And this isn't always social work, but definitely should include social work, and training all staff in advocacy principles. Just in general, everybody can be an advocate for a patient in some capacity. And creating clear advocacy protocols, measuring advocacy outcomes, supporting systemic advocacy efforts. Advocacy isn't just the right thing to do, it's the smart thing to do. Your system needs dedicated advocacy resources. It needs that system disruption, needs trained advocacy and a culture that supports advocacy at all levels. So start by assessing your current advocacy capacity. What are the gaps? What